Hey everybody, got a quick question for you. Do you know what the most common hip disorder is amongst people older than age 50 years old? If you said hip osteoarthritis, you'd be correct. My name is Dr. Austin Bruhl. I'm here at Physical One for another Tip Tuesday today, talking to you about hip arthritis. Hip arthritis is an issue that affects many people in the population, even up to 27% of the general population, and is more common actually in males than females. It basically is degeneration, oftentimes to the cartilage, either that sits on the ball, the humerus of the hip joint, or the socket, the acetabulum. And with hip osteoarthritis, most of the time it's unilateral as opposed to bilateral. So that's just in one hip, not two hips. We see it a lot of times here at Physical One, and we do treat it quite a bit. So I wanted to talk to you today with a couple of tips, 3 in fact, that maybe you can try if you're suffering from this issue. The first tip is pretty simple. Oftentimes, if you're sitting in a surface, maybe a couch, you might find that your knees end up higher than your hips. And this can put a lot of pressure onto the hip that you're suffering from arthritis with. So my recommendation to you is whatever surface you're sitting on, be it a chair, a couch, build that surface up a little bit. Try and get your knees below your hips. So for instance, I have here a foam pad. And if I put this foam pad here, then when I sit, my knees will be below my hips. So that's the first tip. The second tip is that you may even need an assistive device, such as a cane, to offload pressure from your affected hip. So if my right hip has osteoarthritis, and I've been dealing with this, and I can't put very much weight onto this hip, and I end up walking with a limp, I can use a cane to my left hand. So whatever side the hip pain is, I most often want to prescribe that cane to the other side of my body. The cane should measure about up to the level of your wrist at the crease right here, and it should be something that you feel safe and steady with. So this is another option. Talk to your doctor or physical therapist if you need additional help or resources about making the best choice when using a cane. The last tip that I'm going to give you is a stretch that oftentimes we prescribe here in the clinic for hip pain. Here I'm going to use a stretching strap. At home you can use a belt if you don't have one of these. I'm going to loop it around my foot. Again, my right hip is having issues with hip osteoarthritis, so for the sake of this demonstration, it's going there. I'm going to then lie onto my stomach, bring this stretch up over my shoulder, and then carefully and slowly pull my leg up towards my hips, relaxing in this position. And I can hold this position to my tolerance, anywhere between 15 to even 30 seconds. And I do feel it right here to the front of my hip in my hip flexors. So that is the third tip for hip osteoarthritis pain. Again, I was Dr. Austin Bruhl here at Physical One. For Tip Tuesday, please like this video, like our Instagram page, subscribe to our YouTube, and we hopefully look forward to seeing you.